Hello and welcome everybody to today's ISNTD Connect webinar. Lovely to see everyone tuning in today, and a very warm hello from me. I'm Marianne Comperet and I'm speaking from the International Society for Neglected Tropical Diseases based here in London. Today we're going to be tackling a fascinating subject, a terrifying disease, sleeping sickness, and its vectors, the tsetse fly. There's been a huge amount of press in the goal of this disease. 2020 was designated as a target year for the elimination as a public health threat of sleeping sickness worldwide, and building on a huge amount of work in vector control and also in improvements in treatment, that goal looks in sight. However, this is only one step in the next target, the 2030 target, whereby the new NTD Roadmap is seeking to have 2030 as a goal for the sustainable elimination of transmission worldwide. So today, to look a little bit more and delve a little bit more into ahead and tools that have been developed to achieve these goals, it's our absolute pleasure here at ISNTD to welcome Catiane Vander Kelen. Hi, Catiane.
Hello. Hello, everyone.
Hiya. Catiane, you're tuning in from Brussels, I believe?
Yeah.
Yeah, lovely to have you with us here today. And currently, Catiane is undertaking a PhD with the Liverpool School of Tropical Medicine, based here in the UK, and you're looking at community participation in NTD programs. Very interestingly, your background is actually in anthropology, not entomology or NTDs per se. So that will bring a fantastic perspective to this discussion today. And Catiane, you're going to be telling us a little bit more about the role of communities in using tiny targets. Tiny targets represents the end point of the incredibly fascinating tsetse story, and how scientists have come to discover and understand the way in which tsetse seeks its host and how tsetse spreads disease. So we look forward to hearing all about this today, Catiane. Thank you very much for joining us. And so I'll hand over to you for the time being for your presentation. Presentation of a recent paper published in PLOS NTDs, and then hopefully we will all regroup again for a Q&A and a discussion after that. So thank you very much and welcome, Catiane. Over to you.
Okay. So first of all, thank you to invite me to this webinar and give me the opportunity to share our study. And also thank you for all the participants to be there. So today I will present the result of a study that was recently published in PLOS NTD journal, and that we title Feasibility of a Community-Led tsetse Control, a pilot project using tiny target in the Democratic Republic of Congo. Oh yeah, sorry. Voilà. So as you probably know, sleeping sickness is a deadly disease caused by a trypanosome, transmitted by a tsetse fly. And as you may probably know as well, DRC is the most affected country with sleeping sickness. It reported 70% of the case in 2019. In 2012, WHO targeted sleeping sickness for elimination by 2020, so now. At the time, also, mathematical model demonstrated that to reach this objective, it was absolutely necessary to couple the screening usual strategy with a vector control strategy in some FOXy. In the past, vector control was always considered too difficult to implement, and the trap that was used to catch the tsetse fly was considered too expensive, and this strategy was always neglected from the global strategy. But today we have the tiny target that you can see in this picture. It's a new, cheap, easy to use and effective tool to control tsetse fly. It proved to be effective already in Chad, Guinea, and Uganda. The blue part here is attracting actually the tsetse fly, and in bumping into the tiny target, the insecticide, which is on the black part, goes over the tsetse and it kills them. Voilà. So since 2016, a vector control activity using tiny target has been running in DRC. And this activity can be called or qualified as a program-led activity, which means that it is the national program supported with entomologists. And the program is really managing and implementing the activity on the field. And community are unfortunately not or little involved in this. And it works this way. So tiny target are deployed along the main river bank using a pirogue, and they are deployed every 50 meters there. This strategy already also proved to be efficient in Uganda to reduce the tsetse fly density in the surrounding area. So the aim of our research was to evaluate if a community-led vector control program was feasible in the context of DRC sleeping sickness elimination, because tiny target is a simple tool to use for the community, and also they are deployed in community land. So maybe it would be interesting to involve community in this. So we decided to test a community-based approach in 3 endemic villages in the health area of Dunda. Dunda health area is part of the Kwilu province that we can see in yellow, which is one of the most endemic province of DRC. And Dunda is, as we can see in the map, situated between 2 main rivers, the Inzia River and the Louis River. Here we have our 3 villages. And it's covered with a deep forest that we cannot really see on the map. But what we can see, interestingly, on this map is that between those 2 rivers, there is a lot of water, a lot of tributaries. And actually, those tributaries, for the majority of them, are human-made, and they are actually fish ponds. And because the fish farming actually is the economical main activity in this zone, additionally to agriculture. So this is how fish pond look like. It's like a tributary, it's like a succession of ponds. So it look like a small river, but it's not navigable, obviously. And this created a very favorable tsetse habitat. So we decided, knowing that with the community-based project, we will focus on the ponds area. We will, we will focus on the ponds area instead of the river, because we quickly realized that very few villagers were going on a daily basis on the riverbank. Only some few fishermen were going there. Majority of the people were spending their day in the ponds, and they were probably bitten by the tsetse fly over there. So from that moment, we already took a different perspective from the program-led strategy. So our study is a qualitative study, and we use for that action research methodology. So action research purpose is to provoke an action and study it at the same time. So we impulse a community-based project in our 3 villages, and then we studied it. And we use classical qualitative data collection tool, as we did 24 focus group discussion, 289 hours of observation, and we collect few quantitative data by collecting GPS points of every tiny target deployed in the field to evaluate the general coverage. So how this research was implemented, the field research team impulsed the project. So the research team was composed of 2 Congolese anthropologists and myself. And the research took over 15 months between July 2017 and September 2018. And it goes over 4 phases. So the first phase was a preparation phase, where a vector committee was created in every villages. Then we organized training, there were awareness raising activity, etc. This preparation phase took over 4 weeks per community, so it's quite long. And then we go over 3 different deployments because we have to, the tiny target has to be replaced every 6 months. So the first deployment took quite a long time still because people needed a lot of support and it was the first time they were manipulated the tiny target. And then it goes faster and faster, but still at the 3rd deployment, it took still 2 weeks, which is quite long actually. So our finding, we have 3 different results that I will present. So the first result is about the establishment and maintenance of a community-based structure. So in the positive side, a functional structure was created, and the committee members were very motivated. They were very proactive, innovative. They were solution-oriented. They also report to be motivated to participate to the project because it increased their self-esteem. There were a lot of cohesion in the group, and they feel empowered. And also, very importantly, because it's really important for a community-based structure, they took the leadership. So at the beginning, the research team impulsed the project, but little to little, the committee took the leadership of the project. So the power relation between the research team and the community successfully invert. But unfortunately, on the more negative side, if we look at the community-based structure itself, so the committee, we realize the committee lack of community representativeness. Actually, the chief of every villages wanted to keep the control on the committee member selection. And they select, sometimes they select some friends, their wife, etc., etc. Also, we realized the committee was unequally gender balanced, maybe because the chief kept control on the member selection, but also because women reported that, unfortunately, they cannot really participate to that kind of activity because they have more work than men. After the field work, they still have to prepare the meal for the children, etc., etc. So it's make more difficult for them to participate. And then one other big problem that we face with the maintenance of a community-based structure is the volunteer aspect that created a lot of frustration because they didn't receive any financial compensation, and they were complaining and asking for that all along the research. So the second result is about the tiny target implementation activity. So globally, they make a good use of their acquired knowledge. They did a very satisfactory awareness campaign for the rest of the village. They identified very adequately the tsetse habitat where to deploy the tiny target, and they manipulate the tiny target very well. But in the other hand, they deploy tiny target in a massive, excessive number, as you can see maybe in this map. And there is 2 reasons for that. It's because, as we can clearly see here, the ponds network are very complicated and go in every direction, and it's really difficult to calculate the need without using a GPS or a tool like that. It's much more easier to calculate the tiny target needs when it's a linear river. And also, It's in an excessive number because this responds also to a social logic. People told us that they really wanted to be sure that every bonds of every family and clan were covered. Another problem that we face with implementation is the community-based approach is really time-consuming because people are volunteers, so they are working only at the project when they can, which correspond more or less to 2 afternoons per week. So it takes a lot of time. This is in a world without deadline, it's not a problem, but in the context of elimination, of course, this is a constraint. And then the last result, it's about maintenance of the tiny target and evaluation of the project. So they did a very successful and functional surveillance system of the tiny target. And they also made an evaluation of the project with their own indicator. And they evaluate the project as very effective because they observe a massive decrease of tsetse byte, and also they were sure about the quality of their work. But in the other hand, we had a lot of problem with one part of the evaluation is the GPS data collection, which actually are data more important for the research team to make the report or to the donor, not really for the community. But it was not very feasible for the research team to collect the data on its own because we were only 3 persons and there were so many tiny targets, and the forest is so complicated to get oriented. And so we tried to involve the community in this data collection, but it was too complicated. They couldn't use properly the smartphone that we were using for the GPS data collection. And also, as I already said, it made no sense for them. It was not a data that proved that their project was efficient. And that's a good example of a disequilibrium between community-based empowerment objective and programmatic needs to measure the results. And then we are entering into discussion. So finally, was our community-based approach feasible? Yes. The community-based approach that we tested at least largely worked. We have a functional community-based structure with motivated people, and in addition with a sense of ownership. But we also face many operational difficulties that may be difficult to overcome for some of them. So just to remind, we have some problem with chief maintaining control. We have an excessive number of tiny target, frustration regarding absence of financial incentives, and difficulty with the GPS data collection, and the last and not the least, the time-consuming aspect. So considering this, another question is, can a vector control community-based approach contribute to sleeping sickness elimination in DRC? And again, the answer for me, it's yes. It is clearly not perfect, what we have tested, and it is challenging and probably needs adaptation, but it is clearly an added value. First, because it covered important not navigable tsetse foxes, which are on the heart of the community land. So there is no choice not involving the community in the ponds. And of course, it raised empowerment and generate acceptability toward the tiny target. But it's important also to say that it cannot replace or substitute the program-led activity that are covering the riverbank, because riverbank control is still needed, because if we don't control this part, the tsetse will always make pressure on the ponds. So it's really important to continue doing that. And we think it's going to be very difficult to do a community-based approach covering the river, because people are not really going there, so they don't identify those places to be the place where they get bitten by tsetse fly. Also, there is a lot of land rivalry between villages, so it will be very, very complicated to put the community collectively in charge of covering 100 kilometers of river. And even if we decide to do so, it would take so much time that it won't fit with the elimination objective. So of course, the conclusion is to use a mixed approach. Continue maybe with a program-led approach in the main river, and to use community-based when we can, for example, in ponds area, etc. But of course, there is still a remaining question. To what scale the community-based it's manageable, because we just tested in 3 villages, but the vector control targeted area represents 30,000 kilometers square in DRC, and it corresponds to more or less 700 villages, which is huge. So probably we would have to make choices. And of course, the eternal question is, does motivation will be maintained long enough until elimination? Voilà, thank you. So if there is any question, I'm happy to answer.
Absolutely. A very big thank you, Catiane, from our side to you for this incredible presentation. Very important to have it delivered by someone with a background in anthropology, but also experience in the field. I forgot to mention that you were with MSF and not just working on NTDs, but also in the context of Ebola. And given that not just sleeping sickness, but also a huge amount of NTDs are looking at how to progress in this last mile. Sleeping sickness, for example, has seen a reduction of about 95% of cases, but still these very persistent foci remain. And so collaboration across sectors and with reaching out to those communities will be hugely important. So that was a brilliant presentation, not just for sleeping sickness, but also a lot of food for thought that could be applied across a huge amount of neglected tropical diseases where the disease burden has really declined in the last 20 years. So thank you very much for that. I would normally in the chat remind people to ask a few questions for our discussion, but in this case, I didn't need to do that, Catiane. I think you gave us so much food for thought right throughout the presentation that our attendees just went ahead and sort of asked a lot of questions. And before I move on to those, I just thought I would give a little hello to everyone who's tuned in. So particularly we've got Stephen Brema, Philippe No, hello, Alvaro Costa Serrano from LSTM, Lee Haynes, Sean Freer, Van Jerwin Mercado. So big hello to everyone who's here today tuning in from around the world. I'm sorry I can't mention everyone, but lovely to see you all. So let's delve right into these many questions and discussions that have come up. And first and foremost, perhaps Catiane, if you don't mind, a couple of small, slightly technical questions about the program that you described. So Stephen Brema was asking, what insecticide is the blue tiny target impregnated with? And also another question from Paul Howe, how much do the tiny targets cost? And in case you're wondering, I forgot to mention as well, the system, when it detects a slightly low bandwidth, does automatically turn off our videos. Be the reason why it disappear. So apologies for that. It's just a little technical issue there, but Catiane, you're with us. You're back with us.
But the name of the insecticide, I'm sorry, I don't remember the name. I don't have the name with me. I always forgot, but I can check. But for the price of the tiny target, the old trap were costing about $10 and tiny target at less than $1.
Brilliant. So thank you for that. That's very useful. So moving on to the communities, Mercy Ashipet here is asking, how did you keep the volunteers motivated to continue? Or perhaps what are some of the ideas gathered from your experiences so far that you would like to see deployed? And what do you think would work to keep volunteers motivated?
That's always the big question. It's really a big challenge. I think they were very motivated at the beginning, so it was not so difficult. They were very motivated first by the fact we were there. I think the presence of the research team it was really a motivation factor. They were motivated also to learn new thing and to manipulate something they didn't know about. And it was a constant discussion. The more difficult aspect, the more was about this financial retribution that we had constantly to have discussion with them. And I think this is how we could continue with motivation. But of course, on a long-term basis, it's really complicated because it will depend so much on the community, on the group also. So we are actually starting I'm going to Congo next week to the same community, and we will actually exactly collect data about that, about motivation in a long-term basis. What is the situation now?
Thank you, Catiane. Before moving on to another question, one of the attendees has posted here, the insecticide is deltametrin, 300 milligrams per meter. And this was posted, this is a slight aside here. The attendee's name's coming up as Lee Haynes, but this was signed off as Glyn. And I'm just wondering, Glyn, if perhaps you are Professor Vale tuning in. I hope I'm not wrong. Even if you are a different Glyn, I thought this would be a perfect opportunity to really acknowledge the incredible work of Professor Vale, David Hall, Professor Steve Torr, who is a co-author on this paper as well, and a huge kind of all this work standing really on the shoulder of giants who've spent the last 40 years really trying to control tsetse in Africa. And if you haven't had a chance, I would really invite everyone to go and revisit the tsetse story. It's incredibly fascinating. Sleeping sickness, I remember, was even an illness that we included in our playtime when we were children. I think it just really was one of those terrifying and captivating stories from just in general knowledge. So it's really a fascinating journey to find out more and understand this disease, and also the incredible work that led scientists to realizing that a blue and black square really resembles the most a warthog to a tsetse fly. So I'd like to really pay tribute to that whole body of work in this moment. And it's even something a few years ago now, but was even voted as one of the most important university breakthroughs in the UK over the last 60 years. And that was referring to an artificial cow, but basically the predecessor of the tiny target, which was an insecticide-treated artificial cow. So sorry, I just went on a bit of a tangent there, but I just wanted to acknowledge this huge body of work. Okay, back to our questions, Catiane. Oh, it is Professor Vale, so thank you for tuning in and lovely to have you here. So some more questions about the tiny targets, perhaps expanding the concept to other diseases and vectors. We have here Arlene Betuso, who's asking, can the tiny target work for other vectors?
No, it's only for fly. I think. I'm pretty sure.
And perhaps building on that, Catiane, you might be able to explain, it's kind of related, but why this blue color? Why not red, green, or any other color?
I'm not an entomologist, so I don't know the detail of that. But this color, I don't know why, is the blue who is attracting the tsetse fly.
Yeah, I also don't know really why, and perhaps Professor Vale can tell us why specifically this blue color. But you know, working on these kind of the whole sensory world of the tsetse fly that is the color that emerged, the tsetse fly was most attracted to. And in a few minutes, I will post a link to a lovely presentation, actually, that was given at one of our vector control meetings called ISNTD Bites. And this is a presentation by Professor Gabriella Gibson, who's also worked a lot on sleeping sickness. It is at University of Greenwich. And this retraces really nicely how scientists went about to understand a bit better the host-seeking behavior of tsetse, which incredibly includes putting a cow in a pit underground. I just want to reassure you the cow was not harmed and was fine, but some fascinating science there. So I'll just post that in a few minutes. Professor Vale has also here put a very useful link, a resource on the chat forum. So please go ahead and revisit that. So some more questions here. Paul Howe again. Did you quantify changes in the biting rate to determine the efficiency of the method?
No, because that was not really the purpose of this study. That was really more, this study was really to see if it was feasible to involve the community, so in an operational way. It was not the point to measure if the tiny target were working. There is a lot already. I think there is a few studies already proved that, and that was not the goal of this study. And when I was talking about people observing that the bite reduces, it was based on their observation, based on their own indicator as community member, but it was not measure. It was not quantify this way.
Okay, brilliant. An interesting question here, an observation from Ilya and Dams. Hi, Ilya, nice to see you again. The target seems too tiny or quite small compared with standard targets used mostly for the control in some West African tsetse control. What was your experience in terms of the size?
Like, please again, I am not sure I followed.
Yeah, I'll just flash the question up. I think Ilya was wondering about the actual dimension of the cloth and of the target involved. Presumably that's an optimal size, but do you know of the differences between? I know we've bombarded you here with entomology questions, so in a moment we're going to take a step back, really focusing on the community aspect. Stephen brings us back to the community here, asking how was the data from the community involvement dealt with? Was it incorporated into the overall control strategy? What significant value was the data in the overall control program? I suppose you're dealing with a lot of qualitative data.
Yeah. But I'm not sure to understand the question, sorry.
Stephen, sorry, I'm going to speak on your behalf. I hope I'm not completely wrong, but perhaps, you know, as a social scientist, how would you marry some of your qualitative social scientist kind of data and observation, and how do you marry that with some of the more sort of traditional qualitative vector control data? Have you found any data gaps maybe that you would like to see filled based on your approach?
But it was all qualitative. There is no quantitative data, and again, the data are really not related to entomological data. So I don't know if there is gap in the entomologic part. It was not the purpose of the study, so I don't know if there is. Probably there is a lot of gap, but we just use it's a very, very qualitative research. We use classical tools like focus group and observation and voilà, I'm not sure. I'm not sure the question. Sorry.
That's very interesting, actually, because how do you feel entomologists have taken this kind of study on board, and do you find there's are you kind of looking at two very different things, or is there a harmonious kind of use of this approach? Is there anything that you feel could facilitate perhaps the integration of both the entomological goals and approaches and the social community kind of aspects? Are there things which you felt could work better together?
I think it worked very well together. Just the purpose of this study was to test a way to implement a project. It was not to test a tiny target or to measure density or bite reduction or efficiency, effectiveness. It was really more. So it goes where we work very well. We collaborate very well with the entomologist team from LSTM to do this study.
Absolutely, and to be honest, that is something to be admired. The kind of very collaborative nature of the scientists working on these issues. Again, another paper has just come out a few days ago, I believe, in PLOS NTDs on these tiny targets, a large cohort of co-authors. I'll post those as well in a few moments. So Catiane, I'm just wondering, looking at sort of the future of your research, or I know a lot of the foci remain in DRC, but do you have any other areas that you might be interested in applying this approach to? Are you looking at other countries?
Well, for the moment, I'm really working in DRC. This approach, the one we tested, I don't think will fit exactly the same way in other countries, because it's so dependent on the culture, on the ecosystem, on the beliefs, and the way we did it, it's for DRC. It's for this area in DRC. But I would be in the future very interested to work on community participation in other countries, of course. But for this research, for the moment, it's really tied to DRC.
Absolutely. And I mean, a big component of the NTD Roadmap to 2030, one of its kind of three main pillars, will be focusing on making sure that disease control programs are very much led nationally, are put in the hands of those in endemic countries, whether it be at the government level or research communities, but I guess trickling down from that, the communities as well. Is this for you a very kind of welcome emphasis on local ownership? And as a social scientist, as an anthropologist, is this a very welcome sort of endpoint to the work that you've been doing?
Can you repeat? Yeah. Sorry, were like with internet, I couldn't hear everything. Sorry, there were like kind of a miscommunication.
Sure.
I heard everything.
Yeah, I'll repeat that. I was just wondering, just thinking about the new NTD Roadmap and sort of the guiding principles to 2030. I'm assuming, and as an anthropologist, as a social scientist, how do you view and how encouraging is it that one of the three main components of the roadmap have to do with real local ownership of disease control programs? And what optic does that put your work on community engagement?
Well, I view it very, very positively, obviously, because I think it's so important to involve and empower community, and should be like, for me, it should be even like central and maybe build also around that. So yeah, I'm seeing that very positively.
Brilliant. And Arlene Bertuso also highlights that community involvement in the control of vector-borne diseases is one of the key approaches of, on top of the roadmap, also the global vector-borne response. So if the community requires an incentive, how will you ensure sustainability of the control strategy in the community? And I guess this is a question that can apply to vector control across many vectors.
Yeah. High incentive is always for me. It was a nightmare to deal with, because at the same time, yeah, of course, introducing incentive can be a threat for sustainability, because you have to maintain the system all over the time. But at the same time, in the case of DRC, it was super complicated not giving them those incentives, because in this place of the Bandundu region, people there is so many development projects going on, and they are all giving an incentive, and so it's really difficult to not give an incentive when people are so used to it. So now it's like nearly an obligation when you want to implement a project there. But that's in Congo, it's a really complicated question, this incentive question, and there is no clear answer, and yeah, it's a big question. But
I think particularly in the case of sleeping sickness, the fact that cattle and farmers, the wealth was directly threatened by sleeping sickness and the tsetse fly, wasn't just to do with human health, but also kind of livelihood. That in itself provided quite a strong incentive, for example, to treating cows with insecticide, and that there was kind of a very tangible return there. And it was interesting in your work to see that the communities themselves observed a direct correlation to reduced biting and so forth. So perhaps the kind of very visible incentives are there. It's just about maybe weaving it a little bit more tightly into a narrative for the communities.
Yeah, I've read that in the sleeping sickness that involve animals, so the Rhodesians, community are more keen to participate without an financial incentive, and even to give themselves some economic input. But with indeed this one where the cattle are not threatened, it doesn't work the same way. People are less concerned with their own health than with their livelihood, which I can understand as well. But
no, absolutely, that makes sense. We have one more. Well, Dr. Ivana Haluskova, you've given us a lot of food for thought there throughout the chat. So I would invite everybody to have a look at that in the chat if you haven't already done so. There's another dimension actually that we discussed, Catiane and I, and we're going to be talking about the French language, not just sticking up for our own language just because we're both francophones, but actually that was really an interesting question, and perhaps not just looking at the communities, but perhaps community officers or vector control professionals in a country like DRC, where really the prominent language isn't English, where a lot of firsthand experience and knowledge in the field would be discussed and gathered in French, versus kind of the predominant use of English in the science community. And so I was wondering, Catiane, from your experience and looking at communities on a different level, so not the people living in the areas, but perhaps looking at the scientists as a community, how is this language barrier affecting tsetse control? Is that something we should look at a little bit more closely so we can include and involve our fellow scientist colleagues and program people a little bit more?
Well, I think that it's in general the English as a dominant language on the research field. Of course, in DRC, a few people only speak English, so it's maybe more difficult to access information. But in the field, I don't see there is a language barrier problem, really. In the implementation of the activity, I didn't notice any problem in that way, but it's me. I never really observe or think about that.
Fair enough. And Stephen here is also adding a comment and is saying that letting the communities know the value of their involvement, which is beneficial to prevent sleeping sickness and cattle sickness, would contribute greatly to making them volunteer and perhaps not ask for a financial remuneration. So a few questions here.
It's a few but still.
Oh, pardon, Catiane, I missed that, sorry.
No, so obviously what we try to do all the time to value. They also receive some little like incentive in kind. The work was valued, maybe not enough, or maybe from, but yeah, it didn't. They still were asking for incentive.
It's an interesting question, and as many of you know, the whole kind of rollout of NTD programs depends on this huge network of volunteers across so many diseases, from distributing the mass drug administrations all the way to households kind of emptying their flower pots so mosquito breeding grounds don't take hold. So it's a really interesting and complex issue here about maintaining this community involvement. And in DRC, have you seen much involvement specifically looking at sleeping sickness of perhaps local media, radio, journalists, any kind of community messaging? Is that something that could be improved?
Yeah, probably. Definitely.
Right. Okay, well, Catiane, we just really wanted to thank you. I think it's always, obviously, there's a very big body of entomologists who tune into our meetings and what I might call vector people. And it's always really interesting to hear the disease control narrative told from a different angle. Having you on board as an anthropologist, as a social scientist, particularly in context of something like vector control, where we know that there isn't one single magic bullet, where there isn't a very simple solution will be paramount. So we just really wanted to thank you for coming today, presenting this, sharing your thoughts with us. We'll be really keen to keep an eye on what's the next chapter in the tsetse story. Some huge amount of success there, and as we approach kind of those last very few cases and the persistent foci, it'd be really lovely to see where your research next takes us. So I'd like to thank you very much. We're coming up to the end of our webinar for today. So Catiane, from us all here at ISNTD, a big thank you. And to our attendees, we'll hopefully see you next week for our next episode of the ISNTD Connect. So take care and all the best.